Thank you very much. Good afternoon. We continue to see a number of positive signs that the virus has passed its peak. It's been very devastating all over the world, 184 countries, probably more. This number was as of a week ago. Dr. Birx will walk through some of these trends in a few moments, but they're very positive trends for winning. Going to win, going to close it out. While we mourn the tragic loss of life, and you can't mourn it any stronger than we're mourning it, the United States has produced dramatically better health outcomes than any other country, with a possible exception of Germany, and I think we're as good or better. On a per capita basis, remember that, on a per capita basis, our mortality rate is far lower than other nations of Western Europe, with the lone exception of possibly Germany. This includes the UK, Switzerland, Belgium, the Netherlands, Italy, France. Spain, for example, has a mortality rate that is nearly 4 times that of the United States. But you don't hear that. You hear we have more death. But we're a much bigger country than any of those countries, by far. So when the fake news gets out there and they start talking about the United States as number one, but we're not number one, China's number one, just so you understand. China's number one by a lot. It's not even close. They're way ahead of us in terms of death. It's not even close. You know it, I know it, they know it, but you don't want to report it. Why? You'll have to explain that. Someday I'll explain it. Since we released the guidelines to open up America again, and this was 2 days ago, a number of states led by both Democrat and Republican governors have announced concrete steps to begin a safe, gradual, and phased opening. Texas and Vermont will allow certain businesses to open on Monday while still requiring appropriate social distancing precautions. And I can tell you the governor of Texas, Greg Abbott, he knows what he's doing. He's a great governor. He knows exactly what he's doing. Montana will begin lifting restrictions on Friday. Ohio, North Dakota, and Idaho have advised non-essential businesses to prepare for a phased opening starting May 1st. Throughout this crisis, my administration has taken unprecedented actions to rush economic relief to our citizens. As an example, you don't hear any more about ventilators. What happened to the ventilators? And now they're giving you the other. It's called testing. But they don't want to use all of the capacity that we've created. We have tremendous capacity. Dr. Birx will be explaining that. They know that. The governors know that. The Democrat governors know that. They're the ones that are complaining. Through the Paycheck Protection program, we've already processed nearly $350 billion to 1.6 million small businesses across the nation to keep American workers on the payroll. So we're asking the Democrats to get it done. This should be bipartisan. This should be 100% vote. And it's really been incredible. The $350 billion that's been approved is so popular, and it's keeping businesses open. They'll be open, hopefully forever. Our swift action is directly supporting 30 million American jobs. Amy Wright from North Carolina, as an example, said the program is a game changer for her and her family. It's coffee shops, and she has 120 employees, many of whom have developmental and intellectual disabilities. And now they're all staying, and they're getting paid, and she's got a dream, and it's going to take place very quickly when she opens again. So, Amy, good luck. North Carolina, great place. Scott and Julie Alderink helped lead a church and own a restaurant in South Dakota with about 15 employees. They were already starting layoffs. Layoffs were moving along rapidly. But now they've hired their employees back, and they can keep their restaurant open, and it'll be moving quickly, very quickly, as opposed to not having anybody and probably not having a place to have all of these people employed. She would have been out of business. She would have been gone. The Paycheck Protection Program funding is now fully drained. It's out. It's gone. $350 billion to small businesses. And in turn, it goes to the employees of those small businesses. Lawmakers must stop blocking these funds and replenish the program without delay. The Democrats have to come on board. I used to read that these were Democrat programs, not Republican. Seems to have switched around a lot, hasn't it, huh? Switched around a lot. The Republicans want it. I think the Democrats probably do too. But they also want other things that are unacceptable. This is about COVID. This is about the plague and what it's done to us. This isn't about extraneous things that they've been trying to get for years and that our country doesn't want them to have. As we enter the next stage of our battle, we are continuing our relentless effort to destroy the virus. My administration is taking steps to protect high-risk communities by providing funding for 13,000 community health center sites and mobile medical stations in order to equip them with the most advanced and robust testing capabilities. These sites are incredible. What they can do is incredible. The job they do is incredible. These centers provide care to 28 million people living in medically underserved urban and rural regions, including many African American and Hispanic communities. We're taking care of them. And it's so important because you've all been reading about the disproportionate numbers on African American, and you're reading a little bit less about Hispanic, but likewise Hispanic communities. The numbers are disproportionate. In fact, we're doing big studies on it right now. We don't like it. Not right. Nationwide, we've now conducted over 4 million tests, and Deborah will be talking about that. It's double the number conducted by any other country on Earth. So that's more than 2 times, actually, the number conducted by any other country on Earth. You hear so much about testing. What we've done is incredible in testing. And I started with an obsolete, broken system from a previous administration or administrations. But I would really say administration for a different reason, because testing has become so advanced over the last number of years. And we have the most advanced of all. I spoke with other nations this morning, the leaders, and they all are talking about our great testing capability, and some of them want to know what to do. How can they get involved, because they need it for their own countries. In Louisiana, Massachusetts, Rhode Island, New York, and other hotspots, we have also tested more people per capita, by far, than Italy, Spain, Germany, France, and the United Kingdom, and all other major countries. So think of that. In New York, for instance, per capita testing is 6% higher than in Singapore. In fact, there's a typo. It's 67% higher. There's a big difference. I'd say there's a big difference between 6% and 60%. I was looking, I said, 6% doesn't look too good. It's 67%. Good job out there. Higher than Singapore, 64% higher than South Korea, and 47% higher than Australia. So it's 67% higher than Singapore, which is a very advanced place in terms of what they're doing. My administration has also been speaking frequently with many of the governors to help them find and unlock the vast unused testing capacity that exists in their states. Dr. Birx discussed yesterday the commercial and academic laboratories in the states have tremendous unused capability, which they can use. The governor should use it. Tremendous unused capability. They're waiting for business from these governors that some of them complain. I must tell you, for the most part, we're getting along great with them, but some of them like to complain. But I still go back, because the hardest thing of all, by far, by a factor of 20 is the ventilators, and now we're the king of ventilators. We have ventilators. We're going to be helping other countries very soon. We're going to be helping Mexico. I spoke with the president of Mexico. He's great guy. And I told him we're going to be helping him. They desperately in Mexico need ventilators, and I told him we're going to be helping him very substantially. We're in a position to do that. We're building now thousands a week, and they're coming in rapidly, and they're very, very high quality. But we're also helping governors to develop strategies to smartly deploy their testing capacity to protect vulnerable and underserved populations while getting Americans at lower risk safely back to work. So again, we have tremendous testing capacity. Now, a lot of people like the Abbott test that we came up with. Abbott, it's a brand new technology, brand new test. It's great. It's 5 minutes, boom, you put it in. And we're making thousands of machines. Abbott is making thousands and thousands of machines, but not everybody's going to get that one, but they're going to get others. We have numerous platforms, which we'll talk about in a minute. Unfortunately, some partisan voices are attempting to politicize the issue of testing, which they shouldn't be doing, because I inherited broken junk, just as they did with ventilators, where we had virtually none, and the hospitals were empty. For the most part, the hospitals didn't have ventilators. We had to take care of the whole country, and we did a job, the likes of which nobody. We assembled an army of young, brilliant people. For the most part, young, a couple of older ones. But for the most part, they were young, brilliant geniuses that did a job like nobody would believe. I wish you could have seen it. Round the clock. And now the rest of the world's coming to us asking if we could help them with ventilators, because they're very complicated, very expensive. They're very hard to build. And we have them coming in by the thousands. But you don't hear that from even the governors. Nobody's complaining about ventilators. And if there was a surge, we could have ventilators to them within hours, because we have in stockpile almost 10,000 ventilators. You don't hear about hospital beds. When I first started, everyone was talking, oh, hospital beds, hospital beds. The governor of New York correctly asked me for hospital beds, and we got the Army Corps of Engineers out, and they built them. He needed them. I mean, I know he said that we were projecting. We're not projecting New York. We're listening to the governors. He wanted them. He needed them, and we gave him thousands of beds. In Javits Center, we brought the ship. Then the ship, we had it converted to a COVID-19, and that was a big deal, by the way, because of ventilation and all the things we had to do, but we did. And fortunately for him and for us, all of us, they haven't used either one very much because the numbers have gone down significantly. But it was there, and it was built, and it was beautiful. 2,900 beds. It was incredible what they did. They did it in a matter of a few days. But unfortunately, and it was very good, the relationship was very good. And I'm frankly glad they don't need them, but they were there. Louisiana, the same thing. I think the governor, Democrat, good guy. And he will, I think, tell you a story that we had more than enough. And I said, well, we're supposed to build one more. I called him. I said, you know, if we don't have to build this hospital, it was an additional anywhere from 500 to 1,000 beds. If you don't need it, would it be possible that we don't build it? Would like to build it someplace else, or not build it at all and save money, which is okay for government too. Use it someplace else. And he called me back the next day and he said, sir, we don't need it. I said, that's great that you say that. I appreciate it. And he didn't need it. But we were ready to go. We took good care of Louisiana. We took good care of Michigan. We took good care of every place. We didn't miss a trick. And we're in great shape on testing. We have different platforms. We actually have 9 different platforms. And on Monday, we're going to be adding one. That'll be 9 to 10. I don't like to count on them before they're up, but we'll have anywhere from 9 to 10 platforms with a tremendous testing capability. And people can go, and especially with phase 1. Now, at the same time, just like with ventilators, we're building now the best ventilators. Just like with ventilators, our testing is getting better and better. I took the first test. The first test was not pleasant. This was not a pleasant thing. I said, you got to be kidding, to the doctor. You got to be kidding. up your nose, and then we hang a right, and it goes down here, and then we'll wiggle it around here under your eye, and then we'll pull it out, and we'll say, I said, no, there's no way that can happen. Is that the way it goes? You sure? This was a very unpleasant test. And then I was tested a few weeks later with the new test that just came out, the Abbott, where they just touch your nose, basically, and they put it in a machine, and literally a few minutes later, they tell you if you're fine. And I was lucky in both cases, because I've seen the damage that this does to people. But we have great tests. They've really gotten better and better and better as we go along. But we have a tremendous laboratory capability all over the country. And for some reason, the governors, they're not, a lot of them are, but some of the governors like to complain and they're not using it. We have tremendous capability. We're ready for them. And as we go along, just like with the ventilators, we'll get better, more advanced, and, you know, we'll be able to do things that nobody would have even believed possible. But we started off with a broken system. We inherited a broken, terrible system. And I always say it, our cupboards were bare. We had very little in our stockpile. Now we're loaded up. And we also loaded up these hospitals. And, you know, we're talking about payment. We gave billions of dollars worth of things to hospitals. And we'll have to work that out at some point. In fact, I guess they're going to be working that out with Congress. But we loaded up hospitals. The federal government loaded up hospitals with things to take care of people that are very desperately ill. We weren't worried about payment at that time. We said, you'll take care of it at the right time. But we gave billions and billions and billions of dollars worth of medical goods and medicines and equipment to hospitals. And we'll work it out with them. But people don't like to talk about that. So we have done a job that nobody believed. This was a military and private enterprises march. We marched. And unfortunately, with the other side, because they're viewing it as an election. How did President Trump do? Oh, he did
It's 3 hours.
Terribly. Let's see. He did, he did terribly. Oh, but we just got him the ventilators that they didn't have that they should have had. We just got them hospital beds by the thousands. We just got them testing that they don't even know how to use. In some cases, they have machines that they're only using 5% and 10% of the machine because they have an advanced machine and they don't know how to use it. It can do much more. So we've had people explain how to use it. So I don't know. I don't think I'd do that on the other side. I really don't. I think that here we have a crisis and we have to work together, and I hope we're going to work together. But we're moving along, and we're moving along well. We're moving along well. This should not be a partisan witch hunt, you know, like the Russia witch hunt that turned out to be a total phony deal. Unfortunately, some of these voices, though, are attempting to bring this into politics, and whether it's testing or ventilators or hospital beds or other dimensions of our sweeping public health response, we have had a sweeping response. And speaking to the leaders of other countries this morning, they said, this is incredible the way you've done this so quickly. You know, we're only talking about a few weeks since everybody knew this was such a big problem. And the rest of the world is watching, and they respect what we've done, because I don't think anybody else, I know nobody else could have done what we've done. And we started with garbage. As our experts said yesterday, America's testing capability and capacity is fully sufficient to begin opening up the country totally. Indeed, our system is by far the most robust and advanced anywhere in the world by far. The rest of the world will tell you that. I spoke this morning to a friend of mine, President Moon of South Korea. He just won the election. He won it by a lot. He had a big victory, which I was happy about. And he was saying what a great job we've done in this country. I told him the same thing. He said, what a great job we've done here in this country. So I appreciated that. He had a great, by the way, he had a great victory, and we're very happy about that from the standpoint of our country, working very well with them. South Korea. as we approach, and the approach that we use, but as we approach, hopefully, the downward side of what's going on, I think you're going to see some incredible hard facts and evidence that what we did was right. There's a lot of talk about herd, the word herd. I don't want to show you charts of people that went a different way, but it's scary. It's scary. We would have had, I think, millions of people die had we done a different way. And I think numbers are just coming out where they're estimating 60,000 people will die. That's horrible. I always say one person is too much, especially in this case when it could have been stopped in China. Could have been stopped in China before it started. And it wasn't. And the whole world is suffering because of it. But this herd concept, and everybody had to think of it at the beginning because look at us. We had the greatest economy in the history of the world. Better than China, better than any country in the world, better than any country has ever had. We had the highest stock market in history by far, and I'm honored by the fact that it has started to go up very substantially. That's because the market is smart. The market is actually brilliant. I've seen it. And they're viewing it like we've done a good job. They view it that way. Because if you would have told me that we're at 24,000 or beyond, and the highest we were ever was, we never hit 30. We were getting close to 30. So let's say around 29,000. We're at 24. We were heading down. I would start to say, oh, wow, we may be heading into territory where I started. I didn't like that. Now we're way up. But if you would have said to me, with what we've gone through, not caused by our country or our people or not caused by certainly anybody within our country, but if you would have said that after going through this horrible plague, that we'd have a stock market that's much, much higher than when I started, much higher than where I started. And I think I think we have tremendous momentum. We have a big election coming up, but I think we have tremendous momentum. First, we get rid of the plague. And because of what we're doing with the PPP, what we're doing with the Paycheck, as we call it, I think we have a chance to have these companies get back to action quickly. But our approach to testing is based on facts, data, and very hard evidence, not partisan agendas or coordinated political talking points. Mike Pence, who's a phenomenal guy, is making the commencement address right now at the Air Force Academy, where they're being very politically correct. Everyone's standing not 6 feet, but 10 feet apart, okay? And it's very different. I made that speech last year. I'm going to West Point. I think they're changing the date to June 13th because of what's going on in New York. They're moving it to June 13th, West Point. So I'm doing that commencement speech, and they're going to have, sad, but it's a big start. They're going to have the cadets. They may not have the parents, but they're going to have the cadets. The parents are so proud of them. I know at the Air Force Academy, where Mike is speaking right now, they don't have the parents. They have the cadets. They're very, very widespread. And you talk about social distancing. I mean, they are really spread. I looked at it. They're using 10 feet. So he's doing that. But they're having it. It's very important to have it. And that's a great thing. That's a great thing. That's a big start. So he's there right now. And I will tell you, he's a gentleman, Mike Pence, a real gentleman. And the Democrat senators requested a phone call with him yesterday. And I think they had, for the most part, all of them on, like approximately 47. I heard it was just about all of them, whatever it might be. I don't want to be wrong by 1 or 2 or 10 and have the press say, he lied, that he told a lie. Terrible, terrible. Whatever it was, but they have 47, and I guess most of them were on. I heard they were so rude. I used a term today. I said rude and nasty, but I heard they were so rude. No matter what he said, which was all very positive in terms of winning this battle against the invisible enemy, no matter what he said, they were fresh, they were nasty, and it was, I heard, just a terrible thing. And I said, Mike, that's politics. That's what it is. if we came into this room today and said, the battle is over, we have won, it's 100% gone, the Democrats would say the president has done a horrible job. He has done a disgraceful job. It is a shame how bad he is. You know, this is the talking points. This is political, and it would be nice not to have that, especially when we've done the job we've done. I mean, all you have to do is look at the big V for victory or V for ventilator. Take a look at it. Everybody said they had us on that. They had us. They thought they had us, but we got them done at numbers that nobody would have believed. And we did use our act, our production act, and we used it, but we didn't use it. We didn't need it like a hammer. All we had to do, for the most part, we used it actually in a number of cases, but for the most part, all we had to do is talk about it. All we had to do is say, we're going to use it if you don't do this. And everybody was, you know, for the most part, good. We used it a couple of times because it didn't work out the easy way, but it worked out the hard way. But whether it was masks or ventilators, it was incredible what we've been able to do. So this is a very critical time for the American people, and the American people deserve real information and responsible and thoughtful dialogue from their elected leaders and from the media. The media's been some very honest, but some very dishonest. You know that. You know that. I mean, I even read a story where Mark Meadows, this tough guy, he was crying. He was crying. This was a Maggie Haberman. You know, she won a Pulitzer Prize for her coverage of Russia, but she was wrong on Russia. So was everyone else. They should all give back their Pulitzer Prizes. In fact, it turned out that the crime was committed by the other side. The crime was not committed by this side. It was committed by the other side, a bunch of bad people. You saw the reports coming out over the last 2 weeks. They got caught. So Maggie Haberman gets a Pulitzer Prize. She's a third-rate reporter, New York Times. And we put her name up here last week. You saw that. People thought it was a commercial. It wasn't a commercial. It's like a commercial, but it wasn't a commercial. It was just clips. And because we exposed her as being a bad reporter, what happened is she came out and said, Mark Meadows was crying, and they made it sound. I said, Mark, and it's okay if he did. I wouldn't, you know, look. But I think he was crying probably really for the wrong reason they had it down. But he's not a crier. And if he was, I've known criers. I could tell you people that you know that are very famous. They cry, and that's okay, too. But it was a nasty story in so many ways. It was fake news. And she only did it because we exposed her for being a terrible, dishonest reporter. She is. I've known her for a long while. I haven't spoken to her a long time. I made the mistake. I take a picture with her at the desk a long time ago. Every time she does a story, if I say, I haven't spoken to her in many, many, many months, maybe years, I don't speak to her. She's fake. A lot of people are fake. A lot of people. We got a lot of fake people. But what happens is she writes this story as retribution, puts it in the New York Times, and the New York Times is a very dishonest newspaper. It's my opinion. It's not an opinion. It's actually, from my standpoint, you know, the very hard thing to figure, though, most people wouldn't know that, but I know because I know the facts. And they make up, I said it today, they make up words. Sources say, most often used, sources say. You know what sources say means? Sources say means they have nobody, and they make it up, okay? And they have a few other type statements that mean the same thing. But sources say is the most often used expression in the Washington Post, New York Times especially, CNN, fake news, CNN. They should really be mandated, and I mean mandated, to use a name. If there's a source, use a name. Say that Kayleigh McEnany said, or somebody. And you'd find out that the, number one, the source wouldn't say it. The sources don't exist. I don't believe the sources exist. And I try and tell this. You know, the beautiful thing about doing these conferences is that we have tremendous numbers of viewers, and I'm able to reach the viewers without having to go through fake news where they make a good story into a bad story. So with all of that, it's been an incredible period of time. We've done a fantastic job with the talk of other nations. The leaders of other nations are calling us for help. They're calling us for equipment. They're calling us for testing capacities. Now, With the testing, we are going further. Deborah's going to talk about that now. With the testing, we have some other tests coming up that are going to be, I think, phenomenal. I think they're going to blow away everything as soon as they come out, and we're going to get them out as soon as possible. But I'd like to ask Dr. Birx to come up and say a few words about where we've come, how far we've come, and more importantly, where we're going from this point, because honestly, it's quite amazing. Thank you very much.
Thank you, Mr. President. If we could have the first slide.